I've just been diagnosed with peripheral artery disease. Should I be worried?
Peripheral artery disease, or PAD, is not to be taken lightly, because if plaque is blocking the arteries in your legs, odds are it's also blocking the arteries supplying your heart and brain, putting you at risk for a heart attack or a stroke. It could progress to a severe obstruction of blood flow called critical limb ischemia. If it does, you'll likely lose a leg and maybe your life.
You've got my attention, so what do I do now?
PAD is treatable. Your doctor may recommend lifestyle changes such as quitting smoking, a healthier diet, and exercise. You might need medications to manage blood pressure, lower cholesterol, and control diabetes if you have it. For some, angioplasty or bypass surgery may also be necessary to restore proper blood flow. PAD will not go away. Take steps so you don't either.